Hello guys, so today we will discuss about an important topic about rheumatoid arthritis. It's very common in the young age as well as you see in the older age groups. So what is it? Basically, it is a chronic, it is a chronic autoimmune, meaning your cells are fighting, your own cells are fighting against you, inflammatory, chronic autoimmune inflammatory disease. So it's involving the joints, mainly synovial joints. Okay, and it's progressive joint destruction. It's very progressive, not sudden. It's very progressive joint destruction. Okay, and when you see a young woman okay, with bilateral hand pain, associated with morning stiffness, this can be okay lead to, we can say it might be rheumatoid arthritis. So what are the tests? How do you know? What investigations do you send? So there are two important serological markers. So one is the RA factor, rheumatoid RA factor. So what does it suggest? It says that it's more aggressive disease, more extra articular manifestations, more aggressive. Okay, it suggests that it's more aggressive and more extra. How do you confirm? Your RA factor becomes positive, and then how do you confirm? This is not the confirmatory test. And what is more specific? It's called the anti-CCP, which is more specific and also confirmatory test for rheumatoid arthritis. So mainly you initially send RA factor along with ESR. You see elevated ESR along with the positive RA factor. Then to confirm if it's rheumatoid arthritis, you again send anti-CCP, which is more specific. Okay, it's also a strong predictor. If questions comes like strong predictor of erosive diseases, it's more erosive diseases, anti-CCP is the answer. Okay, more aggressive RA factor. Anyways, so anti-CCP is a better predictor. Okay, better predictor for the disease severity. Now, some clinical features. In some patients will find these subcutaneous nodules. You find these nodules in rheumatoid arthritis. Okay, so I'll tell you which joints are involved. In the case of, we already learned about osteoarthritis in the first lecture. In rheumatoid arthritis, so there are few joints that are involved and there are joints that are spared. So joints that are involved in RA are proximal interphalangeal, metacarpophalangeal, and also wrist is involved. Which is spared? You have to remember which is spared is the distal interphalangeal joints in the case of rheumatoid arthritis. In the case of osteoarthritis, what is spared? Which is involved in the rheumatoid arthritis? MCP and wrist are spared. Rest, PIP, DIP, and carpometaophalangeal of the thumb. Okay, is involved. Okay. So remember which is spared. In RA, the distal interphalangeal is spared, and in osteoarthritis, MA and wrist is spared. Okay. So we learned about what condition it is. We found the clinical manifestations. The joints are involved, and the investigations. And then, so now let's go with the management. Okay. First line again, you give NSAIDs. If it doesn't work, then you go with methotrexate. Okay, methotrexate. So what is the drug of choice? Drug of choice is for RAs, methotrexate is the drug of choice. Methotrexate is the drug of choice for rheumatoid arthritis. So guys, I told about subcutaneous nodules, right? If is most common cutaneous manifestation, most common cutaneous manifestation in RA. Okay, so how do you treat this? How do you manage these? Management is intralesional steroids. You inject steroids onto these, and then the swelling will subside. So like we said, which joints are involved in RA? Wrist is metacarpophalangeal joint, wrist joints, and also PIP. Okay. I'll ask you another question. What is the most specific antibody? Most specific antibody for RA? It's anti-CCP. We learned before. What is the confirmatory serological test? It's basically an antibody. So more specific antibody is anti-CCP. What CCP? CCP is citrulinated peptide, full form, antibody. Citrulinated peptide antibody. Okay, anti-CCP. Now, there's another question. What supplement used in case of methotrexate toxicity? What do you use? You can give folic acid. Okay, it's a folic acid. Now another, how do you manage pregnant ladies? How do you manage pregnant ladies? Methotrexate is contraindicated. You cannot. Trexate is contraindicated. Then what do you give? Which are the other drugs? More safer drugs like hydroxychloroquine, HCQ. HCQ. Even we give. I've seen rheumatologists prescribing HCQ along with methotrexate. Okay, but it's safe. It's safe in pregnant women. Hydroxychloroquine. Sorry, it comes in 200 mg once a day. 200 mg once a day. Okay, can be given. What is another drug? What is another safest drug? Another safest drug is sulfasalazine. Okay, so yeah, methotrexate cannot be given. Okay, so basically, a pregnant woman comes, then what do you do? If pregnant woman comes with rheumatoid arthritis, what drug? You stop methotrexate and you continue the HCQ. Okay, you can continue the HCQ. Anyways, so this is all about rheumatoid arthritis. If you are liking the lectures, please do like and subscribe for more. These are short lectures, and more will be coming in the upcoming. More topics will be covered in the upcoming lectures. Thank you.